Hello and welcome to this webinar where we will be asking how will digital health technology make for better outcomes, better paths for health and a better way to care. Data from the Digital Health Report published as the Guardian Supplement this week, which you can access on the webinar platform, by the way, noted a staggering 6,500% increase in the number of healthcare practitioners recommending digital health tools to their patients, and 99% of GP surgeries having moved to offering video consultations. That's not very much of a surprise to you, I'm sure. The fantastic panel of speakers with me today will bring their insightful perspectives on this remarkable take-up of digital health technologies. We'll touch base on some of the challenges, but also the way forward in leveraging these innovations for better outcomes. My name is Neelam Patel. My organisation, MedCity, represents the Life Science Cluster for London, boosting innovation and investment for the health and wealth of the nation. And before we start, I'd like to ask the panel members to introduce themselves very briefly, and then we can kick off on the discussion. So, Uday, would you like to start, and then Dean, and then Andy, and then Indra?
Thank you, Neelam. Yes, my name is Uday Bose, and I'm the Managing Director and Head of Human Pharmaceuticals for Boehringer Ingelheim United here in the UK and Ireland. We're based in Bracknell, and we support patients and animals with products from the pharmaceutical side.
Thank you. Dean.
Hi, thank you so much for inviting me to join the panel. I'm Dean Russell. I'm the Member of Parliament for Watford, but I'm also a member of the Health and Social Care Select Committee and the Joint Committee for Human Rights, along with being the chair of the Digital Health APPG. And I have a particular interest around digital health, but also mental health. And I look forward to hearing the comments and the questions and feedback today.
Thanks, Dean. Andy.
Hi, thank you, Neelam. So I'm Andy Catcher. I'm General Manager for GE Healthcare Digital for Northern Europe. Thank you.
And Indra.
Hi everyone, I'm Indra. I'm the director of the NHS AI Lab, and the AI Lab, it's a focal point for accelerating the safe adoption, but also the ethical and effective adoption of AI technologies into the front line of health and care. Thanks, Neelam.
Thanks, Indra. So I'd also like to say it's a pleasure to be part of London Tech Week. I'd like to thank Media Planet and Frontiers Health in hosting this as well. So why don't we kick off, actually? The percentage increase of GP surgeries having moved to video consultations is pretty impressive, and last year obviously has been unprecedented. But Uday, tell us a little bit from your perspective as to what impact COVID-19 has had on delivering patient care through remote technologies. Has it been effective?
I think it's dangerous to get swayed by the headlines on this one. I think it was inevitable that people would move towards the virtual platform. What we've noticed, what we've discovered through the work that we do with the healthcare system is that a lot of patients, though, have been unable to access these platforms. Healthcare in itself is a very sensitive topic, so it's not something often, many patients are reluctant to go to their GPs anyway. To then have to consider doing that on a remote consultation, potentially on a platform that you don't have or you're not comfortable with, makes it very complicated. And what we've noticed is actually there is a correlation because to poverty, access to digital technology, and access to better health outcomes, they're all related. So I would agree definitely there's been a significant shift in that direction, and that's great for many people, but we just need to be mindful that we don't leave many other patients behind.
Thanks, Uday. Yes, that's a really important point, actually, and I think all of you have touched on this divide issue. And Indra, I'm just coming to you now because obviously that is a challenge, and some of the work that you've been doing is around data, hasn't it, and the bias that might introduce. Can you tell us a little bit about that and maybe some examples?
Yeah, absolutely. And one of the things we've really noticed over the past year as we've set up the lab is how important the quality of data is, but also the proportionality, and how whatever the problem you're trying to solve is really applicable for the population you're trying to solve it in. And so last week we've launched something called the AI in Ethics Initiative, and we've partnered with some really fantastic people in the Ada Lovelace Institute and the Health Foundation, as well as Health Education England, to really start addressing these issues, what we call the knottier issues in healthcare, to make sure that both researchers, innovators, but also the workforce understand the importance and are able to recognise when bias might be introduced in these data-driven technologies?
Well, that's a huge sort of topic, really, and it sort of also borders on data and trust as well, doesn't it? And Dean, I want to come to you here because you've mentioned, I think, the opportunity of using data to prevent rather than cure, and we're talking about improving patient outcomes here as well. To what respect do you think data can be used in prevention and cure, and what are some of the challenges around that, do you think?
Thank you. I think there's a huge scope for this. Ultimately, any device that's digital or technology-based at some point will collect some form of data, and I think at the moment there's a lot of silos around that. So for those people who perhaps got Fitbits or Apple Watches, they're collecting health data on a level that might have seemed to be science fiction a few years ago, and now is absolutely firmly science fact. But the ability to then share that with your GP, for example, or a hospital when they're monitoring you, isn't necessarily a simple process, even though it should probably be simple. So there's a whole load of questions around safeguarding, quite rightly, and privacy, and the security of data, which absolutely have to be explored and looked into. But I think there's also how do we engage this into the future? Because I think the consumer world is, as usual, quite far in advance of any other big sector, and that includes government, not because there isn't a willingness to try. And I know NHSX, for example, has done amazing work in this space, and it's great to hear today from the NHS and from the guests. But I think there's an opportunity to see where does this look, not just in the next 2-3 years, but in the next 10, 20, 30 years. And my vision for this is very simple. If you could find a way to create what I would call a single patient view for every patient that goes across health and social care, and you could connect all those dots so that somebody who perhaps goes for a hospital appointment and finds they've got arthritis, for example, that we look long term and say, actually, how can we help their lives? How can we monitor them? How can we support them through that arthritis getting worse if we don't find a cure? But also, how do we connect that into social care so they can get the right wraparound care in 20, 30 years' time? And I think the digital aspect of this, in terms of prevention and cure, means that you've got two things going on. One is the ability to monitor the data at the point of need, and the work that's happening in places like West Herts Hospital Trust in my patch around virtual wards is a great example of that. But also, how do you connect the dots in terms of that data into the future, so you can start to look en masse about how to find cures? Because if, for example, you had a series of patients, for example, doing real-world clinical trials who perhaps are taking a cancer drug, imagine if you could monitor their Fitbits and their Apple Watches and other ways of collecting data of potential side effects of any drugs they might be taking. That could be done on the case of thousands or hundreds of thousands of people in real time to help identify cures, help identify where issues lie. Whereas at the moment, obviously, it happens during the clinical trial phase and to a point afterwards. And I think the opportunity to connect those dots is just immense and actually very exciting if we can get it right into the future. And AI obviously has an important role in this as well.
Well, that's fantastic, Dean. Actually, it very nicely links me to the question I have for Andy, actually, around imaging, particularly, and how your organisation, Andy, has been connecting the dots using data, but imaging data. Can you tell us a little bit about the networks and some of the impact that you've been seeing out of that?
Sure. So I think there's a number of layers within the imaging network. So first of all is just getting the basics in terms of sharing data in a really constructive way. So whether that is an image or reporting, so you could load balance the workflows and be more productive in getting the right care at the right time for patients from that perspective. And I think there's some specific user cases like MRAD that already achieve that. The next level now is, okay, we have collected a lot of data. How do we start to really utilize that data, label it, curate it, ready for AI, so you can take the imaging network to the next level that feed into the planned imaging networks and diagnostic hubs that will be coming from that perspective, then we will get to a point where we're really moving into precision health and understanding from an acute perspective how to deliver cost-effective healthcare, but more better quality outcomes for patients. And I don't think we're far from that now. I think the next level beyond that is actually integrating social care data in a preventative way. So, for example, you may have a patient with heart failure. Heart failure is a hereditary condition. You can use GP data to identify whether there's any clinical history within the family to identify that. By doing so, there's a risk already. So can we be using wearables like Dean was mentioning about, is there a change in the ECG that I should be referring them to a diagnostic pathway, even in vague symptoms, to stop heart failure? That's where we really start adding value to the end patient in stopping heart failure and a cost to the system.
Wow, I mean, that's really impressive what you said there. I think, I mean, we've started talking about data. I still think that, you know, there are some challenges around the trust issue and also the standards and frameworks enabling these innovations to be scaled. Indra, have you, as NHSX, sort of done any work around making sure that innovations that are accessed are safe, and what people can expect in terms of, you know, data enabled and AI enabled technologies?
Yeah, I mean, that's a really broad question. But what I would say is already there exists a number of standards and frameworks out there. A number of years ago, Neelam, MedCity and the NHS, we worked together with PHE and NICE to develop something called an evidence standards framework for digital health technologies. And we're currently working with both the regulator, MHRA, and NICE to build on that to make sure that we can have a suitable framework for AI technologies. And what I mean by AI technologies is those technologies that use elements of machine learning as they progress in their product life cycle. But more importantly is making sure that there's a range of standards that address things like interoperability, clinical safety, as well as accessibility. And recently we've updated something called our Guide to Good. So it was called a Code of Conduct. Feedback from the community was a bit wishy-washy. Could you really make it clear what it is? And so within that Guide to Good, we've put in 12 areas that innovators should really look, which include standards and frameworks when developing technologies. And on the flip side, the innovation team has released something called DTAC, a Digital Technology Assessment Criteria, which again is around helping commissioners as well as wider buyers out there to say, well, what are the criteria involved to make sure that technology essentially does what it says it will do.
Well, that's brilliant, Indra. And actually, I wanted to then ask Uday, Dean, and Andy then, you know, from particularly from an industry point of view and a community point of view, how have these standards and frameworks sort of helped innovators from where you're sitting to develop the right technologies and also access the ecosystem and then provide the necessary care and outcomes. Uday, can I come to you first on that question?
Just listening to the conversation, we're all patients as well. I think we often forget that. But as a patient, it's so exciting, right? The opportunities out there, the innovation, linking data to health and health outcomes. What we've discovered at Boehringer Ingelheim is we took some time to actually speak to frontline NHS workers in terms of innovation and what they feel about it. And what we learned, and we're partnering with a digital pioneership program here in London, is for many innovators, actually, they don't know how to navigate the system. They don't know how to get a great idea to the front line of patient care. So many ideas, so many wonderful, experiences from frontline NHS care get lost because people can't navigate the system. So working alongside the AHSNs and NHSX and others, we actually developed a guide, an innovator's guide, which serves as a bit of a roadmap to help innovators navigate the system. Because I think often, and we see this a lot in research, the end of research is when you can't take those ideas forward. It really kills all the motivation and speed as well. So I think the standards that Indra just described are critically important, but it's so important people are aware of how to navigate their innovative ideas quickly through a system so that they can maintain that momentum towards the patient.
Thank you for that. And what about patient involvement? How are you involving patients? And then I'll come on to Dean and ask you that question as well. So are patients at the heart of what you're doing here as well?
Yeah, so it comes back to what I said earlier, that we recognize that the patient must be at the center of why we're doing everything that we're doing. So we recognize that there is a voice of the patient that is often missed. Because people so much focus on the technology and the platform, and they forget to maybe consult the patient and understand how will the patient engage with that. So one of the partners on the guide is the Patients Association, who have recently they've published their surveys as well, especially around the pandemic and the learnings and the insights. So we're really making sure that the patients are at the heart of guiding, what are the kind of channels that work for them, what doesn't work for them, what does good communication look like. But also the people around the patient as well, which is incredibly important. The carers around the patient are incredibly important as well.
Thank you. And so, Dean, the same question really, how have standards and frameworks helped innovation, access and adoption from your perspective?
I think there's several areas really. One is, of course, around trust, and I think everything comes back to trust. And so the transparency around data, around rules, around guidance, around all these things is absolutely key. And I think that's so important, because whenever anybody feels in any walk of life, in any role or anything, especially when it's to do with their health, that somehow something isn't necessarily as it seems, then that causes distrust. And I think, it's so important that that's covered. And I think, I feel very confident in everything that I've seen and read over the past few years, because I've been involved in this area for many years on and off. I feel very confident that we're heading in the right direction, but obviously there's always a need to constantly review and improve and so on. For me, it goes back to the other point, though, around patient experience. About 10, 12 years ago, I remember writing for the Health Service Journal specifically about patient experience and how I felt the websites might one day be prescribed, to help with preventative stuff. And I believe in the article this week that I wrote about the fact that, perhaps in the future, we won't just be prescribing tablets to swallow, but tablets to read, and on our iPads. And I think there's a need there that people feel that the trust there around not just when they're sharing data, but also what they're reading, and that we're giving accurate information and that their data is being looked at. One thing on that, if I may, about, must have been about 14 years ago, I was involved in an initiative called NHS Health Space, which was sort of a distance cousin of NHS Choices and NHS Direct. And the premise of that was how patients could access their patient records, their summary care records. And it was a really important initiative, but in a way it was ahead of its time, because one of the issues then was around things like, could you access an X-ray? And it just, the ability to have, servers big enough to hold gigabyte files just wasn't there, whereas now that is there. And I think, what's happened now is that it's taken a long time for, society to almost, or for technology to catch up with society. And now I think we need to look again at what technology is available now and in the future, and see how we need to ensure that society can now catch up with it. Because I think there's a lot of really great stuff going on, but there might be a bit of skepticism because, when we look at things like big IT infrastructure systems 10, 15 years ago, they didn't quite it wasn't quite as successful as one would hope. And so I think that causes a bit of concern. So we need to sort of build that trust and continue and do it iteratively as well.
Thanks, Dean. And another question that I wanted to ask you, because of that statement you made about technology, or at least society now trying to keep up with technology, I'm really interested, and I think the audience would be interested as to how the UK fares with that. And, how comfortable are, citizens in this country versus internationally? And is there anything that can be learnt there? And I'm also going to ask that question of the others as well, in terms of the UK perspective versus internationally. But Dean, if you go for that one.
Well, my personal view, and I guess I'm biased, I think we have incredible rigour within the UK, but there's always a need to improve that. And that, you can compare internationally on many different areas, and some we're going to be ahead of the game. Others, there's perhaps room where we can move further. I'm always of the belief that, Britain is a leader in the world. The UK is a leader in the world, and we want to always be ahead of the game in these areas. And I think that one of the areas for me that I feel very passionate about is innovation. Not just for, no offence to the big companies on here now, because they're doing an amazing job, but also for innovators, the startups, I was very fortunate. I did a podcast. It was launched just very recently with the founder of the Good Sam app. And that was known very widely across the UK for signing up 800,000 volunteers last year during the height of the awfulness of the COVID pandemic. But actually, it does so much more than that, and including an AI facility that can actually tell your heartbeat based on watching you on screen like we're doing now, using AI to look at tiny colour fluctuations in your face. Now, that was founded by 3 guys. One of them, they're all amazing people, but, not a big government thing, not a massive global multinational. And I think actually what we need to look at is the frameworks around data and sharing, but enabling then innovation from startups to look at actually could they create apps that can really make a difference in different ways and create access to those.
Thank you. Thanks, Dean. So just moving to you, Andy, just the initial question around standards, framework, how they've helped GE in your experience in terms of scaling up, and then also the international perspective would be really helpful.
They're not dissimilar. So if I look at the Nordics, which I'm responsible for, actually they work very similar in terms of frameworks, and they're very much regionalised as well. So what the imaging networks are doing, regions already happen in the Nordics from that perspective. There needs to be a common ground, and it goes back to the patient and what you're trying to do for the patient, etc. The biggest barrier is just not the governance, because the governance exists today. It's more about the partnership working and the mutual benefit to the system in collaborating. So, for example, in MRAD, there was huge benefits in dealing with backlog of reporting, etc. So there was a mutual benefit for everybody to work together as such. I think that there is a piece that's missing from the governance, which you, Dave, and Dean have already touched on, is communication. If you go to a physician doesn't really know about IT. His experience of IT is he can use his tablet, he can have access to his medical records, he can use Google, etc., but quite can't understand why there's restrictions within IT, within the NHS as such. So there's a piece in bringing physicians and IT departments more closely together to get a better understanding, but also in terms of sharing medical records with patients. It's all very well sharing the medical record, but unless you're a physician, you can't translate what it actually means to you as a patient. So we need to think about what information we provide to patients that's useful, that they can understand, in addition to the governance. That is what gives everybody the confidence to move forward.
Thanks, Andy. I see you nodding there, Uday. What's your perspective on that? And you didn't ask my international perspective question, Andy, so I will come back to you on that.
No, I completely agree with what Andy said. I think the information is overwhelming often, and that's the problem. I think just providing the information and saying, look, here it is. From a patient perspective as well, I mean, we work with a group called Patients Know Best who are doing an incredible job partnering with the NHS to make sure patients, because when patients move between healthcare systems, it's difficult because they have to, they don't carry their information with them. So this application allows them to do that. But to Andy's point, it's important that they understand what they're carrying with them and the implications of that. So conversations, communication, education, we never need to miss that step on this journey is my feedback.
So again, I want to home in on the international piece, and obviously Boehringer Ingelheim is an international global company. How are you seeing, digital health technologies grow and be accepted here in the UK versus, other countries? And as Dean mentioned earlier, do you feel that in other countries, society and technology are moving in parallel or not?
So we do a lot of work from the UK and Ireland because the government's got this incredible life sciences strategy, which really puts the UK out there in terms of what our offering is. We're blessed. I know people criticise and challenge the NHS and, the committee yesterday around track and trace. There's so much criticism, but for what we have and what we do, it's incredible. From birth to death, to be able to track a patient, all of their interventions, and they get that. So when I speak to my international colleagues, they recognise the power of what we have in terms of a healthcare system and the ability to use that data. What confuses them is, so why aren't we doing more with it? And I think that's the universal question I get. my encouragement I've seen, especially during the pandemic, is our ability to quickly make decisions and partner effectively is incredible. I mean, what we've achieved with the vaccination, what we've achieved to get to this point, shows everybody around the world that actually when like-minded people come together and they trust each other and they collaborate with the patient at the heart, we can achieve great things. So I'm actually very excited. I'm going into global meetings now in a very bullish way to say, look, well, we've proven it can be done. The data's there, the system is there, and together we can really make an impact here. So fingers crossed we build on this momentum.
Well, that's really hugely positive, and I can see Indra smiling there because I'm sure that's music to her ears in the same way it's music to mine as well. So Indra, from your point of view, and I know that NHSX and you do work globally to make sure we harmonise as much as possible. I mean, are you seeing, changes in parallel in the global situation with respect to digital health technologies? And I say that because obviously an innovator will be looking to affect patient outcomes globally. So, it's really important, I think, to get that harmonisation. But, I mean, tell us your perspectives.
Yeah, I mean, it's an interesting conversation, isn't it? And part of what I do as well is I sit on the expert advisory group for the WHO for digital health and technologies. And what we've seen more widely is that drive across both low middle income countries as well as higher income countries to really adopt. And the pandemic has pushed us during that. And that's been across the world that we've seen that drive. But also the change in attitude. So yes, patients and yes, the public are keen to do this because they've obviously seen the benefits, especially when you can't go and do things face to face. But actually what we've seen is the public sector has also seen the value of data. And I'm not just talking about health data, but more broadly, operational data, for example, really important, especially during something like a pandemic. I also just wanted to come back to the point that you talked about, kind of health inequalities and that global landscape. And really great to hear everybody talk about, the NHS. But one thing we're really, really fortunate here in England and the UK is that we do have what we call the NHS Constitution and the Nuffield Bioethics Principles, which is an immense foundation to really draw upon. And, free healthcare at the point of care is something that the world still looks to. And I think it's really valuable. And it's something that more and more we're seeing a lot of the innovation programs, for example, the AAC, the Accelerated Access Collaborative, are really trying to incorporate something called what we called health inequalities impact assessment. So working with both innovators and providers to say, when you're building a technology, what's the impact of that technology going to have on whoever the end user might be, and really making sure that they have considered what we call equitable access. So, they're not honing in on one particular community, but that is for a broad range of users as well. So just a little plug, they've written a really great article and it should be coming out on their website soon, so do look out for that. But I think it's really important as well to deliberately involve. Quite often people talk about involving patients or the public and they say we have a group, and it becomes more of sometimes a tick box exercise. And what we're trying to encourage, and it's always a needle shift, nothing changes overnight, but it is just a shift of the needle to say, no, actively, deliberately involve people and don't make them participants, make them involved in the whole product lifestyle, be it from conception all the way down to the end product. So I think we've seen a real change over the last year. We've seen some great things here in England and the UK. We've also seen some really good things more widely as well.
Well, thanks, Indra. And I think that's a good segue into just looking to the future, actually. And I've got some questions for all of you in terms of the way forward. And I mean, we've talked a lot around, the opportunities, some of the challenges, the healthcare ecosystem in the UK, which is really sort of open to collaboration. And, some of the challenges are actively being tackled. But what else do you think moving forward that we can keep from what we've learned, and what else do we need to be doing? So again, starting with you, Uday, How do you think policymakers and industry members can help in tackling particularly the digital divide within digital health that we've talked about? And I know that we've been talking a lot around, collaboration, communication. Is there anything else that you feel is something important to take away?
I mean, there's data coming out every day, right, as we're learning more about the pandemic and which kinds of populations have been impacted by it. There was a report yesterday about how women have been adversely affected in terms of their role and workplace and so on. I think there are so many insights, and I think trust is at the core of this, and it's so important that all of the insights that we've had in terms of this pandemic, how it's affected different communities, is addressed. Because otherwise, I think patients, society will just lose trust in the system and in the commitments that are being made. I think we often talk about the big picture, but there are so many groups of communities up and down the country that are being left behind. And this gap is getting wider and wider. And again, digital is one of those things that if you're not on it, and we've been homeschooling here, if one of the kids doesn't have access to something and the other one does, you can see there is an impact. So I think society is going to need to be able to continue to trust us, to act on what we've learned already, because without trust, and Dean made a great point in terms of data privacy, there's a lot of anxiety about what is happening with my data. We're one data breach away from people just locking the doors. People are afraid of it, so we really have to invest heavily in trust. So I would suggest maybe we take time to make sure we address the inequalities that we've identified through policy, through proactive approaches, before jumping onto the next wave of the fancy innovation that gets the headlines.
Mm-hmm. And it sounds like what Indra's just described in terms of asking the questions at the beginning will certainly help with that. Indra, the same question to you actually from a policy perspective. Is there anything that you would add or say to that?
I mean, it's quite hard, isn't it, to add more and more to this conversation. I think what I would say is there really needs to be a practicality. Quite often people love talking, people love saying things, but actually on the ground, having been a frontline clinician for over a decade, you're there on the cold face in A&E with a patient, and some of this just needs to be seamless. This needs to work within your workflow, and it shouldn't be a kind of a digital or a tech. This has to be integrated into part of the care pathway. And so what I would say is, really try and move that needle on a practical and tangible front, and really say, yes, it's great to have discussions and really change and create awareness, but at the same time, just really move the needle for real problems there on the front line.
Thanks. And Andy, we started off the conversation talking about AI and imaging. What do you feel? What do you think an imaging network will look like in 10 to 15 years, and what sort of diagnostics may be carried out?
So I think it will dramatically change from waiting for somebody to become ill and then trying to diagnose them to very much prevention, etc. And we need to, going back to some of the most socially deprived areas, we shouldn't think of digital as digital in terms of its data content. We should be thinking about data in the first instance and how we collect that. And that shouldn't be static data either. So there's an episode of care, that's what's happening in the patient. We should be taking live feeds. So for example, we could be looking at taking telecare feeds to determine on the behaviours of people in the community. And that's low-level digital technology. What I mean by that is that could be a text, etc., that could tell you about the status of a patient because they're feeling dizzy, or their blood sugars are low, etc. So it doesn't have to be in a tablet format, which there's a misunderstanding of what real digital is. It's the collection and use of data that feeds what the future might be. So we could have services in these diagnostics where they're referred to actually prevent something as such, whether that's osteoporosis, fractures, falls, etc., which are huge costs to the system. And we need to think more broadly about how we link the system up and how we commission jointly more effectively from that perspective. And then we need to think about the accelerators for this, the technology. We're very much into the artificial intelligence of pixelated AI or workflow AI. And, you know, G have got the Edison Accelerator program, which is brilliant. That'll get us for the next 5-10 years. Workflows are brilliant. We're diagnosing better. But the next chapter of that, we need to start thinking, if we think about public behaviour, high-intensity sport, do we have a burning issue in 20 years' time around arthritis or cardiovascular conditions, which there's a direct correlation if you look at injuries of fractures and physiotherapy and high-intensity sport. There's a direct parallel growing that it's the tsunami that we haven't seen yet today that may be coming.
Wow, thanks, Andy. There's a lot to think about there. And Dean, from your point of view, I mean, you started talking about joining the dots on the data, use for better healthcare. What's the way forward from your perspective?
I think there's various, building on the points that have been made, actually. I mean, Indra's point about sort of operational side of things, the day-to-day. I mean, we, having come from a background in part where, 20 years ago, I was very involved in accessibility, online accessibility, to enable people with disabilities, but in particular visual impairments, from being able to use the web, because it was a new thing at that time, and you had to have these great big screen readers to be able to read what was on the screen. Websites weren't designed to enable it to happen. So now you open up any mobile phone and it's got a brilliant plethora of accessibility options. And that's over 20 years with a great evolution. And I think that comes back to several points. One, as has been said, put the patient at the heart. We often talk about service design. I think in the future we'll talk about experience design. What's the experience of the patient? You know, do they come out of that appointment thinking that's their 10, 15 minutes over with and that's it? Or do they come out of it being given the tools and the facilities and the access to be able to share greater insights? I mean, we've all been in GP appointments where we come out and go, oh, I wished I'd forgotten to say this, or I'd forgotten to say that, or I wished I'd taken this info with me. You know, actually, if we look at the entirety of the experience of a patient over their lifetime, and this is, as was mentioned, you know, from an NHS perspective, from birth, sadly, to death, that whole experience is, you know, we have touch points with health, social care, and other parts of society throughout that. How do we improve the experience of life for everybody? And health has a massive part in that. And I think that goes to the point then around tools like AI, because often when I've spoken about AI to people in the past, they instantly think of, you know, science fiction films and, you know, Terminators, or, you know, something quite this sort of crazy, either utopian or terrible future. But actually, a lot of AI, where it works brilliantly, is actually just relieving some of the back office stuff. It's often a lot of the boring stuff that it does brilliantly, and that then frees people up to do what they can do on the front line. And I think the other part, then, the third part of those, I suppose, is how do you do the transfer of that data? The reality is data was being collected far long before computers. You know, doctors and clinicians have been collecting data for hundreds of years. You know, it just happens to be written on paper, not on a screen and on a computer. So, you know, I volunteer regularly at my local Watford General Hospital. So over the past year, sometimes weekly, sometimes every fortnight or 2 or 3 weeks, I'll volunteer there. And one of the bits of work that I volunteered on for a period of time was in the maternity ward office. And brilliant staff. They've got loads of data there, but it happens to be in paper files. And I've seen, you know, over the past few years, elastic bands bigger than you could ever imagine, holding massive files together. The process now moving forward is how do you get that data from paper to systems where they're connected and include visual data, connect the data from your Apple Watch into what the GP can see, but also the rapid access to that that's secure and safe to clinicians anywhere. And just on that final point, I think the important thing was mentioned earlier by Andy about, you know, the fact that if you're somewhere else and you need somewhere, you know, a clinician to see it. One of the challenges I saw when I was on this NHS Health Space programme was also who can change that data. Because one example that was given to me then was, imagine if someone had fallen over in the street on a Friday night and they're picked up by a paramedic, and the assumption is perhaps they were drunk, and they get them to the hospital, and then they find out it was something totally different. Who has the right to, if the patient sees that data in their file that says that they were drunk, they will go, well, no, that I wasn't. Can they change it? Can the paramedic change it once they find out? Is it the doctor at the other end that changes it in the hospital? So I think we talk often about data as something that's read, but it's also about who can amend it, who can edit it, and who can change it. And I think all of those things become less of a technology conversation. It becomes more of an experience design and a conversation around the moral and ethical dilemmas of who can access and change data. And that's something we need to look at over the coming years.
Wow. So, I mean, we've sort of moved around what we can do tactically versus what is also needed from an enabler point of view. And you know, with that, I also just want to touch back on Uday, because there was, I think, you know, something in the report that you'd said around BR using some of the pharmaceutical experience around patient experience and how you follow patients through the journey. Is there anything to learn from that, from a pharmaceutical point of view, that can talk to what Dean has also said? Do you think?
Absolutely, absolutely. I mean, and this is why I'm excited for our sector, because we now, for many years now, when we design a trial, we have a patient who's directly impacted by the disease, describing to us exactly what that experience is. Whereas historically, you know, before it was all science-led, it was all research-led, purely science-led. But you have to keep the two together. And we've countless trials now where we've seen that patients at the initial design stage, even of the molecule, in terms of considering the kind of side effects, the kind of lives that how side effects affect patients, for example, but also what they're trying to achieve with their disease as well. So, you know, simple things like just understanding for certain types of disease, you know, skin sensitivity is important. So what kind of needle do you use to draw blood? These are really incredibly important insights. And if you don't get that insight from a patient, you may run a protocol and the trial will take time to recruit and there'll be issues. So it makes patient sense always. It makes economic sense. And then the speed with which we can run these trials, again, becomes a lot quicker. So we've learnt through research that aligning yourself with what's the right thing for the patient early gives you a lot of speed in the process towards implementation as well. So, yeah, definitely.
Thank you. So I'm now going to wrap up, actually, and ask each of you for your sort of final reflections on the conversations we've had that have touched on some of the challenges, some of the opportunities, and also some of the way forward, and also some of the positivity, I think, that we have in the ecosystem and the NHS that Uday very nicely summarised earlier on. So who'd like to start with their reflection?
I don't mind, Needham. I mean, for me, I think we're in a hockey stick effect in the sense that we've had COVID, unfortunately. And if there's anything that's been taken good from COVID is the digital adoption. And I think we have a small opportunity to really accelerate digital adoption for patients' benefits and outcomes from that perspective. It would be a shame that if we're having this conversation in 2 years' time, that everything's reverted back to the norm. I think we have to instill it and provide confidence in moving into those new technologies.
Thanks, Andy. Who wants to go next? Indra?
Sure. I think I'll keep it really brief and just say, you know, I think we've come a really long way over the past couple of decades with both technology, but also how we integrate digital into our everyday lives. I totally agree with Andy. I think we've really got to move that needle on this conversation, that it shouldn't be a different conversation, digital tech. It should just be part and parcel of healthcare delivery. It should no longer have a different name to it. And what I would really say would be a final closing point is we are shifting the paradigm of that slightly patriarchal medicine where, you know, you go to a doctor or you go to a clinician. And the more we can drive that paradigm forward and create an equality between user, whoever that user might be they a patient, a carer, or whoever it might be, I think will really help improve health outcomes and a better way forward.
Thanks, Indra. And then Dean and then Uday?
Sure, very happy to go. I think, you know, for me, there's three parts as usual. There's the technology, you know, and the continued support of innovation, with the safeguarding in place around security and safety and so on. But, encouraging greater innovation, being open to that innovation. No one before the X-ray could have imagined the X-ray could have existed. And then once it did, everyone now knows it and uses it regularly. And obviously from a medical imaging perspective, that's at the heart of so much of how we look at ourselves from a health perspective. I think the second part is about that experience. How do you get those bits right? Because for me, increasingly, the conversation is about social care, quite rightly so, and how do we look at lifelong support for people. So I think that experience bit is absolutely key. But thirdly, I think it's about behavioural change. And as was mentioned earlier by Indra, I think, what has happened this past year, I mean, this awful time with COVID, the NHS has been incredible and so many others have been amazing. But I think the shift has been about actually the adoption by the professions as much as it has been by the public on the use of technology and digital and telemedicine. And I think actually that conversation needs to just be almost relentless moving forward to find how that can really work. What did work? What didn't? What do we need to look at? How do we change that? Because I think if you don't have people wanting to adopt stuff, it won't. No matter how brilliant it is, it won't happen. So you've got to create the needs there. You've got to create then the want. And I think we need to make the opportunity now to get people to want to have this, to make their jobs easier for those who work in the area, but also for patients to see actually this benefits them from a health perspective. And I think if we can get that right and look long term, and I mean decades ahead, how do we adapt? How do we change? I think we could be in a really, really great place over the coming years. But it requires, I think, all three of those to be successful.
Brilliant. Thank you for that, Dean. And finally, last but not least, Uday.
Thanks. Just to build, I mean, as I said earlier, it's so exciting, right? I honestly, the time has really flown by, and there's so much opportunity. There's so much excitement. My only plea or my message to the audience is to understand and remember, innovation doesn't belong to any one individual company. There aren't a group of people who are innovators. We all are patients. We all have an ability to just consider our environment and look around us and have ideas and opportunities to improve things. And I think the pandemic has taken a lot, but it's also given us a great example that we can actually do a tremendous amount when we collaborate, when we partner. So I would, my closing thing would be to just invite anybody and everybody who's got great ideas to help improve patient outcomes to come forward. This is an environment where we can make a difference. We are making a difference, and collaboration needs to be at the heart of it.
Well, thank you very much, and what a great call to action to end on. So I don't have anything more to sum up than what our four brilliant panelists have just said, and just wanted to thank you all for being part of this, and we will see you for the Q&A.
Neelam, we can't hear you.
Oh, there we go. Sorry, technical hitch, how not to kick off the Q&A. Well, thank you to the panelists, and thank you for the audience for sending in lots of really interesting questions. We don't have very much time, actually, so I'm just going to jump into the questions. And what I'd like to do is I will pick out questions and then ask panelists to raise their hand if they feel that this is a question that they would like to address. I do have one, actually, that I'm going to actually shoot to Indra, because I know that she said that she would speak to this one. And it's one that's really asks how we see the digital advancements from the pandemic continuing in the future. Indra, would you like to have a go at that?
Brilliant. Thanks, Neelam. And hi, everyone. Thanks for listening in to this talk. I think it's a really great question, because a lot has changed over the last year. And fundamentally, what's really changed, as we've covered during the webinar, is mindsets and attitudes of both what we call commissioners or payers, but also providers on the ground. And so quite a lot of work is being done across the ecosystem to really embed this, going from how do we really transform outpatients, how do we transform those care pathways, and that transformation is no longer being seen as like it's a digital, but it's actually involved in the whole planning of the program overall. So I think what I hope to see over the next year or so is really, it's just a transformation, and no longer does it become a digital, or that kind of separation out of digital.
Thanks, Indra. I've got a question here actually, which I'm probably going to ask Uday, and it may be just something that you might want to mention about the innovation guide, but it's around how the panel, or certainly Uday, could advise innovators who are creating digital solutions to improve healthcare efficiency and patient outcome. How can they actually navigate the system to demonstrate their idea? Uday, can you...
Unmute. Of course, I had to be the one. No, it's a fantastic question, and that is exactly the question that motivated us to do what we did. So, I think, as I've said before, the guide actually is available, so you can publicly download that through LinkedIn, and it has a very nice glossary and a summary at the end of it that gives you the key information. So, typically within a local NHS trust, within a local NHS organisation, there will be technical support, technical departments where often ideas go directly, but that typically is not the right place for innovators to be going with the idea. So what we found and what we've put into the guide is that conversations in the context of the multidisciplinary teams in terms of what's happening are incredibly important. Clinicians have a tremendous opportunity in the voice that comes through the clinical voice, actually, into the committees, into the forums that they speak to. Tend to be the most effective ways to get in information, at least to start the cascade going through. But Indra, if you allow me, I'm going to just pick up the guide myself now, and if you can come back to me later, I'll put it in the chat, and we can provide that specific answer in terms of the space to go in a moment, if that's okay.
Yeah, that's brilliant, actually, and that wasn't the only question around that, so I think that would be a popular item if you can do that.
I will do, yeah.
Here's a really interesting question around health inequalities, and perhaps a number of you might be able to answer that one, but let me just read it out. And it says, oops, I've lost it now. It says, what steps and processes do innovators that are creating digital solutions, what do they need to do to prevent health inequalities further down the line? And I know that this was a point in discussion earlier, but does anybody want to practically give some suggestions there? Andy, and then Dean.
Thank you, Neelam. I think engaging with social enterprise is a good starting point. They deal with a lot of the most socially deprived areas of the country and provide fantastic services and really engage on what the local community needs are. We shouldn't just think in terms of resource of the NHS and social care. We look for third sector, Age UK, they deal with these deprived areas, and they have a really good understanding of what the need is, rather than building the technology to try and deliver against the need, if that makes sense, Neil.
Yeah, no, thanks. And Dean, did you want to say anything more than that?
Yeah, absolutely. I think I might have mentioned earlier in the webinar about the use of online accessibility. So 20 years ago, I worked very heavily in making sure that websites, for example, were accessible to people with disabilities, in particular people with visual impairments. And I think one of the benefits of that work 20 years ago is now pretty much every device that you use will have accessible features, but actually they're just making the usability of it better. And from dictation through to the ability to make your text larger, for example. And so I think my recommendation would be to make sure that at the heart of anything that's being designed, that you put accessibility there, that you put the patient or the user experience at the heart of it, but also look at all possible ways that it could be used, because the assumption that anybody using any form of technology is going to do it in the way that the designer might think actually often isn't the case. As you'll see with mobile phones, now. Most people probably check, or especially pre-lockdown, most people looked at websites very much on their phones and not on desktops. And it's the same with technology for health, that people might not be using them in a clinical setting, but most likely at home in a much more personal setting. So I think put patient experience at the heart of it and accessibility for all. And I think you're in a much better place then for whatever you're designing or creating.
Brilliant. No, thank you for that, Dean. And so this is an interesting question, and it's about digital twinning. And the question is, how far are we from using digital twinning to support those with long-term conditions? Does anybody want to have a go at that one? No takers. Go on, Andy.
I think digital twinning, obviously, it's apparent now through COVID in terms of the logistics and delivering vaccines. So the adoption of it is already been evident in terms of what it delivers. In terms of long-term conditions management, it depends on what the condition is, because specific conditions are very subjective, and every single patient is individual, and more importantly, their demographic and their social surroundings will have an impact on that. So it's very hard to say what the digital twin adoption will be at this stage. I think it will be used more and more for precision medicine. For what channel, I'm not too sure yet as well.
Okay, thank you for that, Andy. So that we've got quite a few questions on data, actually, unsurprisingly. And there is a question about how the pandemic has affected better access to health data. And are there any examples of that, and how can that be sustained? Can one of you respond to that one, perhaps? You're all nodding.
I'm happy
go ahead, Uday. All of you. Why don't we ask all of you then? Let's start with Uday first.
Yeah, just to recap. So hopefully you guys are going to be able to access the link I've sent to the guide, and just to close that one off, as I've got the mic. Best place for innovators to look at is make sure the innovation that you're proposing is linked to a clinical priority from the NHS. So the NHS long-term plan describes that. So that's incredibly important because it links to what the NHS is trying to achieve. And then what we found and what we've described in the guide is the academic health science networks, the AHSNs, as well as NHSX, and obviously industry partners are great places to go who can provide you with the tools and support to be able to take those ideas forward. But again, I've provided a link, so hopefully you get that. In terms of the question, Neelam, in terms of data, so again, I think we're seeing a tremendous amount of insights coming through in terms of the pandemic, the different types of communities that have been affected. The BAME population data has been highlighted quite frequently. So I think there is a lot more data available. And again, we are seeing that if you link, if you learn from that data, if you use that to drive decisions, that does have a positive impact on outcomes. So I sincerely hope we continue to share and have this level of transparency on the data that we're getting, and it seems to be presented in a very understandable and an organized way, which is credit to the organizations that are developing that.
Brilliant. So we've got a couple of minutes left. So perhaps if I can just ask Indra, as I know that NHSX has done a lot on data, if you can give us your response on that, and then maybe a very quick response from Dean and Andy as well, if they'd like.
Yeah, I was really trying to put something in the Q&A, but I'm struggling technically, so I might send it to the organisers. But there's quite a lot of resources. We built something called an IG portal, Information Governance Portal, because there were a lot of questions that people ask around both data access. Is it okay to use the data? How do I access the data? And that's a really good kind of black and white answer to some of those questions out there. And on the flip side, HDR UK, Health Data Research UK, have also built a really brilliant innovation portal or innovation gateway, which has a whole host of where to access different sets of data.
That's excellent. Dean, anything else that you'd like to say about data?
Yeah, just the fact that I think there's no turning back now. I think the use of data throughout the past year has really increased the transparency around what's available, what's possible, and the access to that. So I think as we look forward, not just from a government perspective, but also from a patient perspective, I think people will start to get used to seeing more data. And very finally, I think that the growth of devices like Apple Watches and Fitbits and so on mean that people are more used to seeing data around their health, and that's only going to encourage us to do more and more in that space, I would say.
Brilliant. And then last but not least, Andy.
Sure. I mean, data, the pandemic has really led to some fantastic partnerships. If you think about the pressure that's in the hospital and that they have to deal with not just from ICU, but also within radiology, in imaging and X-rays and sharing that information. I haven't seen such a unification in the NHS since the pandemic started. I can't thank the NHS enough, but also the ways of working that they've achieved by sharing data has been absolutely incredible.
Well, thank you all very much. And there are a lot more questions that we could have answered if we had time. And hopefully the organisers will be able to get the audience the resources that have been talked about today. So it just leaves me to say a big thank you to the panellists today for the very engaging discussion and the answering of the questions, and also to the audience for joining, and also for Founders Forum and the other organisers for setting this up. Thank you all very much. Bye-bye.